Hi guys, welcome back to the IMG Support Australia YouTube channel again. Today I'm going to discuss with you some of the important things about the AMC clinical exam, which I haven't done even for the other channel. So this is the first time I'll be talking a bit more about the AMC clinical exam. Okay, let's get into it. AMC clinical exam, as you may already be aware, comprised of 16 clinical scenarios or clinical stations or OSCE stations with 4 rest stations. So it's like a 20 station. So you rotate around 20 clinical scenario stations, or how to say, 16 scenarios, but 20 stations in a clinical setting, say in a clinical test setting. It is done either by online, still it's been done online, or in person in Melbourne National Test Centre in Melbourne, Australia. So there's either it is as a online test or as an in-person test in Melbourne. So if I tell you back again, it is the AMC clinical exam, consists of 16 stations and 4 rest stations, altogether 20 stations to rotate around. It's done either as an online test or as an in-person test. The fees and things, I think you can find out in the AMC website, how much you have to pay for the clinical exam. To be eligible to sit for the AMC clinical exam, you should have got successful results in your AMC Part 1 or MCQ exam. Then a bit more about AMC clinical exam and how to practice. That's what I'm going to discuss a bit more about it. So what are they going to test you on in the clinical exam? It's mainly like, just basic clinical techniques, which is like history taking, examination, interpreting investigations, history, examination, interpreting investigations, and diagnostic formulation, which is like most probable diagnosis and differential diagnosis. And then management and patient education. So those are the main sort of components they will be testing you on. So given scenario might be mainly about a history, for instance, or examination station. For example, examination of a shoulder joint or examination of back exam, hip joint exam, anything is possible, abdominal examination, then vascular system examination, like if you test them for peripheral vascular disease. So likewise, there's many possibilities about your examination station. Again, the history station, you can think about, say, taking a history from a patient who's having acute chest pain, or patient who's having abdominal pain, or patient with anything, respiratory symptoms, or a child with respiratory symptoms, anything is possible. So history station, examination station, then there will be stations about diagnostic formulation. So you might be sort of, they would be testing you on diagnosis and management. There's many possibilities. Whatever it is, they will be checking you on those skills in 16 different stations. So there are 16 stations. I think from my memory, I did my MC exam a while ago, but they used to give you some pediatric cases, psychiatric cases, and then surgery, medicine. So within those 16 stations, you expected to get some ONG stations, pediatric stations. You have to pass at least two, one of them, I think, one pediatric, one ONG, at least, and then two psychiatric cases those days. I think it's still valid. It's the same. So there would be two scenarios about psychiatry, and then the rest is like combination. When we talk about studying for AMC exam, as you can see from just behind me, we got all these books. Yeah, we got this one and this one. Just get there. This is the main thing you will be studying, right? AMC Handbook for Clinical Assessment. This is the book you practice again and again. There are so many cases in this book. So you're supposed to study this book in great detail. Okay, this is one thing you will be studying. I'll talk about studying a bit more after showing you the books. And this is the other one, Mertha General Practice. So two main books to study, Mertha General Practice, AMC Clinical Assessment book, clinical book, and mainly those two. I'm looking at the other books, probably this one too, if you can find. Mertha Patient Education. So this has a lot of details about how you explain a condition to a patient. So Mertha Patient Education, Mertha General Practice book, and in the clinical exam, clinical assessment. I'll show you again. AMC Clinical Assessment, Mertha Patient Education, and then you got Mertha General Practice. So those three books are more than enough for you to study for your clinical exam. And then the other thing about clinical examination is like you should be aware about the Australian setting, how you sort of take a history in Australian setting, examination, investigation, and management plan and patient education. For the patient education, this is a very good book if you can read. It's available as a PDF format as well. Then I'll just discuss a bit more about how you study. When you study, I suggest you to sort of organize study groups. Organize study groups and first study this book from A to Z. As I say, from page 1 to whatever the page, the last case, which is about, let me see, 700 odd pages, 780. So you got many, I can't remember how many cases, but you got many cases. If you practice those in groups, like if you could do it over Zoom or even Skype or face-to-face, if you can get together with other people who are sitting the clinical exam, and then you could practice very well. I remember from memory, when we did the clinical exams, we practiced a lot, I would say, many hours, and every day, many cases, few cases every day for a while, at least 6 months to 1 year, I would say. And then if you practice that way, you could get through the clinical exam easy. The other thing is about, like, I think I have discussed this before in a different setting, maybe in my other YouTube channel in Sri Lankan language, or maybe in this one, I can't remember, but it is like practicing to do clinical examination, like these clinical scenarios, make you a good doctor. Like this is your practice in Australia. Once you practice these things, you will be using the same sort of knowledge to day-to-day activity. Even now, we remember these clinical scenarios when we come across a patient in GP setting. Hospital setting is the same, because this clinical assessment book, this has many cases. Some you being a hospital doctor, the others would be you working as a GP. So it got cases in a GP setting as well as the hospital setting. As I said before, it would be about history taking, clinical examination, diagnostic formulation, results interpretation. For instance, I can give you an example like a DEXA scan result will be given to you, and then you are supposed to interpret it and explain it to the patient in wordings that wording that it's the patient can understand, like avoiding the medical jargon. For instance, you won't talk about bone density, but it's using different words to describe those. And T-score and Z-score and everything the patient don't understand, so you have to use different wordings to a language that patient could understand easily. So for that matter, this is the book. If I can find, for instance, one example. I'm just trying to get one example for you guys. Yeah, let's take this example. Here, the Martha talking about what is endometriosis. So then he would discuss the tissue lining your uterus or womb is called the endometrium. Each menstrual cycle, part of it grows and become engorged with blood, and then is shed as a period. Endometriosis is a condition in which fragments of the endometrium grow in other places, such as the wall of the uterus, the ovaries, the ligament inside the pelvis, the fallopian tube, and other pelvic organs. So just describing endometriosis to the patient. So talking about the lining of the womb, like the language they can understand. Just a simple example from Mathaj patient education book. So likewise, you could use so many things so many examples if you use these books. I strongly suggest you to study the AMC book again and again. Like from my memory, I think we might have done role plays of many cases, many times of this AMC clinical assessment book. And then towards the closer to the exam, like the clinical exam, you would read through the book your own, and then some of the knowledge, Australian kind of knowledge needed for your exams can be gathered from the Mertha General Practice, the main book of Mertha. So in short, then, clinical exam include 16 stations. And then only thing I forgot about, like how long is a station. So I will describe it here. One clinical station is 8 minutes long, and then you get a 2 minutes reading time. So you get 2 minutes reading time. The case scenario would be outside the door if you attending the exam in person. So the case scenario would be outside the door. So you get 2 minutes time to read it, and then there will be a bell ringing for you to go into the room, and then you do the clinical scenario with the examiner, or maybe a medical student, or maybe a role player, or a relative of the patient. So there's so many possibilities, but you got 8 minutes to perform 8 minutes to complete the case. Within that 8 minutes, you may be taking a brief history, quick history, covering all the possible diagnosis and differential diagnosis, and then examination covering the diagnosis and differential diagnosis again, investigation to rule in and rule out the diagnosis, and interpreting them, and then discussing the case with the patient and management. So I think you got some idea about how to do the clinical exam and then what to use to study. 3 books I have shown you. Main one is AMC Handbook of Clinical Assessment. You do it in and out. You practice it again and again. For some people, even myself, although I said that you better read Matha, I didn't use much of the Matha because of the I come from a medical education background, so I had a bit of theory knowledge behind me, and I did mainly on the clinical exam book. But here and there I use this patient education and Matha general practice. But for a person who wanted to start it from scratch and then who practice in a different country and come here to practice, I suggest to use all these 3 books. Okay, I think I covered enough for you guys. And if you have any questions, please don't hesitate to put them under this video. Thank you.